Hi everybody, my name is Ollie. I'm a junior doctor living and working in the UK, and welcome back to my YouTube channel. Today we're going to be talking about this fairly controversial Freedom of Information Act about COVID mortality rates that came out a little while ago. And we need to start this video by saying no, not just 17,000 people have died of COVID, which is the reading of this data that I've seen plastered around in a few different news outlets and headlines. But just to fill you in on a bit of the background of what's happened, this story has been in the news because there was a Freedom of Information Act, an FOI request, asking, please supply how many people have died from COVID-19 alone with no underlying health issues from November 2019 to December 2021. And this number was returned as 17,371 people who had died in the UK in this time frame, with COVID listed as the only cause of death on the death certificate. So people ran away with this a little bit and went, oh, this seems very low. You know, the whole thing's a hoax. They've been making it up. They've been inflating the numbers. For those unfamiliar with where this data comes from, this has been provided by the Office for National Statistics, the ONS. They are the executive office for the UK Statistics Authority. They report directly to Parliament. They're responsible for tracking a huge amount of data, primarily related to the economy, population, and society level operations. So things like births and deaths, accurately tracking the number of each, fall under the remit of the ONS. And this number, this 17,371, was spread on social media, most visibly, I think, by David Davis, who is the Conservative MP for Halton Price and Howden. Forgive me if I've got that name wrong. In reference to a video blog by Dr. John Campbell, who is a YouTube creator who made a video analysing this data. Dr. John Campbell, for those of you who, again, aren't aware, is a YouTube creator like myself. He is a retired nurse, nursing educator, and he holds a PhD in nursing education. So he goes by Dr. John Campbell. He's a very well-educated, clearly very well-experienced man. He's been celebrated by many people on YouTube and on social media for his very level-headed approach in reviewing the COVID statistics as data became available. To be clear, I've watched this video myself. I've rewatched it twice now, where he goes through this reading of the data, and I genuinely don't think he's gone out of his way to spread this as misinformation. He has done his reading of the data, and he's always been fairly consistent before. I, in my opinion, said some quite rogue things about vitamin D and ivermectin, but generally, I think he's actually been pretty good as a reader of the data. I think the issue more centrally is that people often misinterpret the things that he says, run away with them a little bit, and because he has such a large audience, more than 2 million followers on YouTube now, this can generate problems. But let's just take a closer look at this number, 17,371. Before we zone in on that number, we need to understand how death certificates actually work. When a doctor, like me, fills out a death certificate at work, we have to certify the cause of death to the best of our knowledge at that time. And as you can imagine, this can be incredibly complicated because deaths themselves are often very multifactorial, multiple conditions which are linked together in various ways. And so we use lots of different sources of information to help guide us in making this decision. Things like lab tests, x-rays, past medical history, a medical examination at the time, and so on. And when we fill out a death certificate, we have to list all of the causes of death that we think are relevant. So someone might have sepsis, which is what ultimately they die of, but this might be on a background of heart failure or diabetes or cancer, all of which probably would be relevant to the death of that patient, even if not the immediate cause. So say someone dies with COVID-19, we can either say that they died due to COVID-19, as in it was the primary cause or the underlying cause of death, or we can say that their death involved COVID-19, and this is where the rub is. Huge numbers of people have at least one health condition that they are diagnosed with. That might be an existing cancer, it might be a heart problem such as an arrhythmia or a heart failure, it might be lung disease, it might be diabetes. And if any of these people get COVID-19, we might expect these people to do worse than someone who is perfectly healthy, or at the very least doesn't have a problem diagnosed at that time. So let's be clear, 17,371 is not the number of people that have died where COVID was the underlying cause. That is an incorrect reading of the data. There are at least 140,000 deaths recorded where COVID-19 has been recorded as the underlying cause of death. Another way to think about this has been illustrated extremely well by James Tucker, who is the Office for National Statistics Head of Health and Life Events Analysis. In approximately 9 in 10 deaths, so about 90%, where someone has died with COVID recorded on their death certificate, COVID was thought to be the thing that ultimately led to their death. And we need to pick these things apart. We cannot make the assumption that someone with high blood pressure, heart problems, diabetes, cancer, all the rest of it, was going to die tomorrow from that condition. Because in fact, most people are very well medicated for these things. If these people get COVID, however, despite all their medication, they can do very badly, even though they weren't at significant risk from their blood pressure. Heart failure and COVID is a very different clinical picture than heart failure by itself. And let's be really clear about something. UK doctors cannot and do not fudge the numbers. It's a legal document that we have to fill out to the best of our ability and understanding, and it benefits the average NHS doctor in no way at all to inflate the number of COVID deaths. My salary, my job security, my career progression, none of that is linked in any way to the number of people that I diagnose with COVID or that I convince to get vaccinated. It doesn't make any difference to me or anybody else. And everything that we do at work leaves a paper trail, remember, whether that is literal paper or electronic. If we put COVID on a death certificate and that person had no signs, symptoms or test results or anything else indicating that they did have COVID or likely had COVID, then eventually it would be found out when people audited the paper trails. Is that worth risking my professional registration for, especially when I don't benefit from it in any way? No, of course it's not. So to conclude, 17,371 is a massive understatement of the death toll caused by COVID. It's been firmly debunked at this point, and anybody who pretends otherwise at this point is simply misleading you, I'm afraid. So stay smart, read the data. Take care everybody, and I'll see you in another video.